All right, and we are going live now.
Thank you, Aniela. Good morning, everyone. It is October 24th, 2023, 8:04 a.m. I'm Deanna Diamore, Director of Health for the City of Norwalk. I'm calling the Board of Health meeting to order. Present, we have board members Janet Karpiak, Joan McNeil, Terry Quell, and Ken Lalim. And we have Norwalk Health Department staff members Aniela Pignon, Megan Fogno, and Brian Weeks. So good morning, everyone. The first item, I see Dr. Weinberger, I think, is in the attendee. And y'all are able to promote him to panelist? Thank you. Great. And we have Dr. Weinberger. Good morning, Dr. Weinberger. The first item on the agenda is the approval of the September 26, 2023 meeting minutes. Do I have a motion?
So moved.
Dr. Weinberger moved. I think Terry seconded. Do we have any comments, any edits, any discussion on the minutes? All right, hearing none. All those in favor, say aye.
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 Any opposed? Abstention? All right, that's unanimous. Thank you. So the second item on the agenda today is to talk about a core competencies workforce assessment that we've conducted at the health department. So just to give you a little background, we've been involved in formal workforce development initiatives since, initially seeking accreditation. I believe our first workforce assessment was in 2012, and our first workforce development plan was finalized in 2013. So we've been doing different, updates and assessments over the years. We've, done different versions of this assessment. Megan's been involved in assisting this in the past as well. And now with Aniela in her new role as a project coordinator, she's coordinated the workforce assessment for us based on the core competencies. So she's going to talk about, with the methodology she utilized and some of the results. And we're looking forward to utilizing these results to finalize the workforce development plan and help us steer some of our trainings moving forward. Before I pass it on to Aniela, does anybody have any questions about workforce development? All right, I'm going to pass it to you, Aniela. Thank you.
Thank you, Deanna. Good morning, everyone. Excuse me, I still have that morning voice. All right, so I'm just going to share my screen quickly. And we can get this ball rolling.
Right. Aniela, sorry, can I just interrupt for 1 second?
Yeah.
I just want to share that Aniela presented this on a statewide call last week. They had over 100 participants on the call. So they also were able to learn from her and our experiences at the health department. So hopefully, I know people got a lot out of it. So I want to thank her for that.
Thanks, Deanna. All right, so jumping right into this, as Deanna mentioned, we administered the core competencies for public health professionals. So that's what we're going to be talking about today. I'm going to give you guys a little bit of an overview of what that assessment is actually comprised of, talk about our methodology for assessment, and then review some of the basic findings from the assessment. So just a quick overview of the core competencies for public health professionals. They are a consensus set of knowledge and skills for the broad practice of public health as defined by the 10 essential public health services, which you guys should all be pretty familiar with. As you can see, I've got the rainbow color wheel on the side. And the core competencies are broken up into 8 domains. The first is data analytics and assessment skills. There's policy development and program planning skills, communication skills, health equity skills, community partnership skills, public health sciences skills, management and finance skills, and leadership and systems thinking skills. So the actual competency assessment was developed by the Council on Linkages between Academia and Public Health Practice and adapted for use by the Public Health Foundation. It's a self-assessment, basically asking respondents to respond to 56 questions to respond on their perceived level of proficiency on those questions. Again, they're broken out across 8 domains, and staff are assessed across 3 tiers. So we had, the tier 1 frontline and program support folks who are really responsible for a lot of that initial kind of programmatic support. So a lot of the customer service, collecting and analyzing data, supporting programs, providing some of the health education and technical expertise around the work that we do. The second group of folks that we surveyed was the Tier 2 group, which is program management and supervisors. We consider those folks to be the ones who are really enmeshed in programs and service areas. So usually not more at like a higher level, but really enmeshed in a particular program. And they're the ones who are developing, implementing, evaluating, improving programs. They're usually working pretty closely one-on-one with, like 1 or 2 staff members who work with them and, mentoring them, making sure that they're, supporting the program. They're also the ones who are really working closely on like timelines and specific program activities. And then our third group of folks that we assessed was Tier 3, our senior management and executive leadership. And those are the folks who are doing some of the higher level organizational work, our supervisors on the supervisor team, aka our senior management team. I know that's a little bit confusing because at the Norwalk Health Department, we refer to our supervisors and our senior management team as the same thing. Here, we had this broken out as, supervisors are in Tier 2, senior management is in Tier 3. So just keep that in mind as we're kind of moving through this. But again, Tier 3 is really looking at that higher level stuff, looking at organizational culture, organizational vision, strategy, all that high level stuff. Oh, in the wrong order. All right, so back to the actual assessment. The purpose of the assessment is really for us to allow staff to gauge their own understanding and skill of their public health competencies. It's also a really great tool for us to understand where staff are with their knowledge and skills and helps us to figure out what our starting point is for training and for developing other priorities for our workforce development. It's also a really great tool just for kind of understanding and meeting other workforce development needs. We have things related to accreditation, reaccreditation that are really key for us to meet. And so ensuring that we know where our workforce is, what their needs are, and how we can meet them is really a critical part of this assessment. So we administered the assessment really in sort of a 2-part methodology. The first part was the actual administration of the assessment. So what we did was in the end of July, we had an all staff meeting where I presented on just a general overview of what the core competencies were and a general overview of the actual process that we were going to be using for the assessment. So that way staff were pretty familiar with what was coming their way. So they knew that there was going to be an email coming their way with an attachment with hard copy guidance from the Public Health Foundation. And they knew that the email was also going to contain a link to a Microsoft Forms survey where they'd be responding to those 56 questions. In the survey, we had all of the information that was in the hard copy guidance. That was really just an additional tool for them to have in case they needed that support. So during the survey, we actually collected information about each individual's role at the health department, how long they've been at the health department, and how long they've been in the field of public health, because we wanted to gauge, whether there was any sort of trend between whether an individual has been in a particular department or division rather, or whether they've been in the field of public health, and if that has anything to do with their perceived level of proficiency. So we had staff respond to those 56 competency statements using a scale of 1 to 4. They could also indicate that they did not understand the question. So the scale, as you can see, is right to the side, with 1 meaning that the respondent felt that they were unaware or had very little knowledge of the skill that they were responding to. A 4 meant that they felt very comfortable with, felt that they were an expert on, or felt that they could teach the skill to others. So when we got these assessment results back, and that took about a month and a half or so, we actually had 31 staff respondents, which was awesome. You can see the breakout right below of how many staff per tier. And what we did was we averaged the scores for each of the 56 competency statements for each of the tiers. And then for each of those tiers, an average domain score was also calculated. And that was helpful for us to be able to understand trends across domains and between tiers. Trends that we were looking for included identifying trends across and between tiers, like I mentioned, but also looking for trends through a division or program area lens to better understand what individual program areas or the staff underneath them, where they might benefit from a little bit of training or some other sort of workforce development. So I'm going to jump right into tier 1 and take a look at the just the sort of the breakout of how we looked at scores. So first, as I mentioned, we asked all of our staff how long they've worked at the Norwalk Health Department. So as you can see, we have a pretty good breakout across timelines. Most of our staff are actually here, or the biggest chunk of our staff has been onboarded within the last 1 to 5 years. So we have a lot of new staff members. So I think that means that we have a lot of opportunity for growth and training, which is awesome. And then as you can see from our second pie chart at the bottom, most of our folks at the health department have been here for somewhere between 1 and 20 years. That really takes the bulk of it. But I think that means is, we don't have too many newbies here at the health department right now, and not too many people who have been here for 20 plus years, but really we have a lot of people who are staying for that good chunk of their career. So diving into the scores of the individual domains, as you can see, what we did is we averaged out the score for each individual question. So a respondent would be asked, how confident do you feel in your ability to effectively describe factors that affect the health of a community? There was a little bit of a description there. And then the staff member would respond with a score of 1 through 4. And we averaged out the scores by tier, as you can see. So this was what we came up with in terms of average scores for domain for tier 1. As you can see, we did the same thing for domain 2, policy development and program planning skills. Domain 3, communication skills. Domain 4, health equity skills. Domain 5, community partnership skills. Domain 6, public health sciences skills. And domain 7, management and finance skills. And lastly, domain 8, leadership and systems thinking skills. So we repeated this with tier 2 and tier 3. I'm not going to take you through the same slides because they look pretty much identical, just with slightly different scores. But what we ended up doing was taking a look at the scores for each of the tiers and comparing them across a domain. So what I thought was really interesting about this is that you tend to see that the same sort of trend is apparent in almost every question where, tier 2 is just slightly more confident than tier 1, and tier 3 is just slightly more confident than tier 2, which in my opinion, I think, is indicative of, sort of that leadership and just trajectory throughout your career of, gaining skills as you kind of move up the ladder. So I thought that was a really interesting takeaway. There are a couple of areas where that is not the case, specifically in domain 3, communication skills. I do want to point out, though, that we have our health educator who participated in this assessment, and there were only 3 respondents for tier 2. So her communication skills, really weighed in heavily on the scores here. So as you can see, these are sort of the general scores here. Almost everything was under a 3. We had a few things where we were just slightly over. But overall, we seem to trend somewhere between 2.5 and 3 for a lot of questions. So I just wanted to just kind of tie in that the efforts that we are going to be making based on our core competencies assessment and there are findings that we have in that are really tied to our health department strategic plan. One of the values that we came up with, which I'm sure you're all pretty familiar with after our strategic planning last year, is that we value the development and growth of our staff, volunteers, and public health workforce. And that is really just, sorry, my computer's dying, so I'm just moving. That is really just kind of a starting point for me to just bounce into our findings and training needs by tier. So we found a number of things that sort of were across tiers, but we also found some individual findings by tier. So I'm just going to highlight a couple of the ones that I found really interesting. So for tier 1, our frontline staff, these are our folks who I mentioned are doing our customer service, a lot of our one-to-one work with patients and clients. While they tend to feel connected to maybe the direct outcome of their particular service, they really are having a hard time feeling connected to their the overall impact of our work on the community. And so a lot of that comes from not understanding, but a lack of confidence in understanding the general public health landscape and all of the systems and barriers and tools that are in place that kind of shape that overall public health landscape. Administrative staff who are not working in anything programmatic seem to feel even less confident in a lot of these areas, particularly the ones that have to do with community health. Frontline staff also don't feel super confident in engaging with policymakers or in their ability to influence policy. They feel that they would benefit from things like opportunities for professional development, particularly areas like management and finance skills that could really support their growth into the next phase of their career. In tier 2, we had a lot of similar findings, but there were some other things that I thought were pretty interesting and very specific to tier 2. So while there are also there's some desire to learn some more information about the general landscape about public health, there is really more of a focus on kind of creating those opportunities for cross-sector alignment to actually address the issues that are coming out of the systemic challenges. And while they are very comfortable implementing and evaluating or implementing policies, they are not comfortable developing or evaluating those policies. So a lot of this is, like I said, they're very comfortable understanding sort of the big picture, but they want more tools to be able to understand how to make the big picture work for them. In tier 3, our senior management team, as I mentioned, it seems like tier 3 folks are slightly more comfortable with most of the competencies than our tier 1 folks. However, they tend to feel really gridlocked by the system and the barriers that are in place. And their ability to influence policy or their confidence in their ability to influence policy is influenced by that gridlocked system. So there's sort of not a need exactly for big picture training, but there is more of a need for making training available that helps us to learn to prioritize diversity, equity, inclusion, and justice initiatives, and just sort of that approach in general, just so we can get that landscape under control. Other things that we noticed that tier 3 would find helpful are skills, again, around financial and human resource management. That is really just something that, operationally we could benefit from. And then lastly, I wanted to point out that across all of the tiers, but particularly in tier 3 and tier 2, there was an interest in or a feeling that staff members didn't have as much of an opportunity to contribute to the evidence base. And so we believe that finding those opportunities could be beneficial for our staff members. So overall, we identified a couple of all staff training need bucket areas, and this pretty much just encompasses all of the different the domain areas, but I grouped them together. So the first area that we're really could use some area or use a little bit of focus and improvement on is data analytics and assessment and the public health sciences, specifically in assisting our staff in learning to collect, analyze, manage, and leverage data, and also understanding the public health informatics landscape. So understanding all of the different software systems that we have in place, how they work together, what they're used for, how we can optimize them and leverage them, that kind of stuff. So really just so much out there right now. And as Brian, I'm sure can tell you, it's really ever changing the software that we're trying to use at the health department. The second bucket was communication skills and health equity skills. So identifying strategies for communication and identifying ways to combat dis and misinformation was something that was needed across the board. And then again, finding a way to address structural and systemic barriers, whether that's is some sort of a presentation to staff on a regular basis or an annual basis, just on social determinants of health, something like that, where we're really just looking at sort of the primary factors that influence a community's health. The third bucket was community partnership skills. So things like sharing power and ownership. So really just kind of learning, how do we collaborate as a community? As I mentioned, some training on social determinants of health, and particularly some training on community resilience. A lot of staff members seem to indicate that they felt a little bit more comfortable with understanding the public health landscape and the problems that are there, but not as comfortable understanding the protective factors that are there and the opportunities. The fourth bucket was the manage and finance skills arena, which I'm sure comes as no surprise. So as I mentioned before, securing and managing HR and financial resources, developing policies and practices with the DEIJ lens. And then the other big thing is contingency planning. So planning for emergencies, succession planning, that kind of thing. And then the last bucket was leadership and systems thinking skills. So as I mentioned, most of our staff members feel that they could benefit from some sort of training or opportunities to engage policymakers to influence change. They also want opportunities to create opportunities for creativity and innovation. So, not just sticking with the same old formulas that we've used in public health. I know we're actually a pretty innovative field, so I don't think there's too many of those, but really just an opportunity for everybody to, explore their creative muscles and exercise those. A couple of last additional findings and training needs. So opportunities, as I mentioned, we really need to address some of those big picture gaps, especially for our tier 1 folks. And the biggest part of this is identifying ways to make our staff feel that they can make an impact and to help our staff feel connected to the actual impact that they are making through their role here at the health department. More opportunities for creativity, innovation, and staff empowerment. An index of informatics resources with explanations and examples. And that would be, we think, pretty helpful for folks just to understand what's out there in terms of software. What can it do? What do we have the capability to do? And also developing community partnerships via connections with newer staff and background or administration staff who don't always have the opportunity to engage with the community. And then a couple of training areas that we identified were DEIJA, which includes accessibility. And we would like to focus on that in policy, but also in practice. How do we make those things happen in practice? We'd like to review the 10 essential public health services, as I mentioned, probably on an annual basis with our staff. We'd like to do trainings on organizational health, particularly for our senior management, but really for everybody to understand what makes a healthy health department. Advocacy for various audiences. So, not just speaking to policymakers, but how do people advocate? How do our staff advocate to community members? How do they advocate to their clients for things? Mm-hmm. How do they advocate to their partners? And lastly, trainings on softwares, because we all know that they are, always updating and always coming out with new ones. So the next steps for us are going to be to just finalize our training priorities and then get a training schedule in place and get everybody trained. So that's what we're looking at for the next 2 years, 2024, 2025. It's going to be in our workforce development plan. Okay. And that is all. So at this point, I will take any questions if there are any.
Thank you, Aniela. That was a lot of information, and you synthesized a lot. There's a lot, a lot of respondents, a lot of information to really get all those themes out. So it was incredible work. Thank you.
Mm-hmm. Thank you for the opportunity to share.
So hearing no other questions or discussion, I'm going to move on to the next item on the agenda, which is the mayor's dashboard. So Wanted to let you all know that the mayor has been releasing parts of his dashboard this month, and the health department is featured throughout different pages. And so I really want to thank the staff who've been working directly with the mayor's office on coming up with good data and indicators that reflect the work of the health department. So Aniela, Teresa, and Brian, and all the supervisors really, Megan, Bill, Darlene, Glenn has been involved. I know I'm missing people. Who am I missing? But really everyone worked and put together thoughts to, what should we highlight for the city. But so I want to just point out a couple pages. I'm going to share my screen just to show you what the relaunch looks like. And it's really, it's a great, storytelling, right? So it's in the past, the dashboard was, all the data, the charts, but the new relaunch of the dashboard is combining the narrative with the data to really tell the story. Can you all see my screen? Okay, so this dashboard hub is on the city's website, and so far 3 pages have been revealed and announced to the public. Most of our data is in a safe and healthy city, but I do want to point out, I'm going to go to an environmentally sustainable city, because there are a couple indicators here. What's interesting is, we also partner in a lot of these initiatives too. Like, we've been involved in providing grant funding to help support some of the tree planting initiatives. And then you can also see, some of that work highlighted here that's led by the other city departments. But you may recall the heat vulnerability study that we partnered with Circa on, that the health department really played a key role in helping to coordinate with the different city departments. So that work is also highlighted here. And then we have our annual rainfalls. As you know, we monitor the rainfall to help assist with figuring out when, shellfish beds need to be closed, or when we recommend no swimming due to high rainfall. So that information is also collected here. And you can see a link there in the dashboard to our rain gauge. And then in a safe and healthy city, it's, the police department, some of the fire department, the health department, as well as early childhood, which is part of human services and community services as a whole. So it's really nice to see, right here, well-established health department. And this is, so the police data is up here. And then if you scroll down, here's our inspections data, environmental inspections. Then we have data on the patients that are served in our clinics. We have some of the lab services, and then WIC is also really highlighted. And so we were sharing information about this last week. One of the quotes I said after talking to Gastine in the WIC program is, they're a small but mighty team. Like, they're able to see so many families and serve so many clients with, they go between 3 and 4 staff members, depending on, the funding and depending on, any staff vacancies, but they really do see a lot of people. So I don't know, our whole team, obviously, I will talk how amazing our staff is and all the great work that they're doing, but it's just such a high volume of work, and it's a big breadth and, broad work that's going on across the department. So I wanted to share that with you all, and I will be sure to send the link out to you all so you can see it. But really, it's great work that putting this together, the staff and the mayor's office and the IT department as well. Any questions or thoughts on the dashboard?
No questions, but it looks really good. It's very impressive to see the work being showcased on the mayor's website. So that's awesome.
Yeah.
Well done, everyone.
Thanks, Terry. All right, now I'm going to pass it on to Brian to give his updates on the respiratory virus season and his surveillance. So take it away, Brian.
All right. Hey, good morning, everybody. All right, so we'll just talk about the respiratory illness season and how things are right now, and more or less it's kind of mild, knock on wood, it stays that way. So as you'll see, I'll jump right into the COVID-19 new hospital admissions levels by U.S. county from the CDC. Reason being is that we're currently in a state of transition with the wastewater monitoring, which is another very helpful metric to kind of see where things are at. So more or less, the funding, basically it's like a new funding period, and a new provider has been selected by the CDC. It's just a matter of just moving over to that new provider to do the testing and provide that information. So unfortunately, that means we're at a pause. So without further ado, though, we still have new hospital admissions. So again, looking at severity of illness, it's going to be a really good indicator for COVID-19. And as you can see here with the new update from the CDC as well, actually it's, you have only about like 6.62% of counties in the moderate, and then only about 0.68 counties in the orange or the high. And as you can see, looking at more the Northeast, we have New York State, a little bit of Vermont, and, parts of New Jersey that are experiencing this in terms of moderate. But fortunately, Connecticut's, not in that loop yet. So again, keep in mind that a few weeks ago, though, we were, again, that was New Haven, Middlesex, and Litchfield counties. But fortunately, right now, we're kind of experiencing a little bit of a lull relative to COVID in the state of Connecticut. But as you can see, other parts of the country, especially with the Midwest or the mountainous Midwest, if you want to call it that, or mountainous West, whatever you want to call that region. But over here, you can see how a lot of counties have kind of entered the moderate level. And again, this will fluctuate, as I mentioned at prior meeting. Again, because it's only one metric dictating this, because we used to have the community levels, which actually had like 2 or 3 different metrics that are kind of weighing in and affecting each other in terms of classification. This will fluctuate more. So that's also kind of the other caveat to keep in mind. But nonetheless, again, it's kind of a lull relative to COVID, a little bit of quiet. And again, that shouldn't create a false sense of security, but that's just something to keep in mind. And then so looking at the landscape of all the different subvariants circulating, right now, the predominant subvariant for the country is EG5. We also have another one in the mix now, HV1, but then also kind of some of the usual ones that we've been seeing, FL151, XBB1.16.6, HK3, XBB2.3, ... So more or less, the story is, they are being monitored by the scientific community. Nothing really that concerning relative to especially the evasion of, current therapeutics as well as the vaccines. There's the Parola subvariant, which actually isn't listed here. And that one is the one that, has the 30 or so mutations, but currently its national prevalence and incidence is actually very low. It's around like 1% or less. And so it's not really being accounted for yet, but that's the one to also keep an eye on, that, the scientific community is as well. But still, so far, it hasn't had much success in this country, but in other countries it has, in terms of it, increasing its incidence. So, that's kind of just the current story. And again, same thing with, any new subvariant that pops up, inevitably it makes it throughout the rest of the country. So then looking at it for the National Emergency Department visits for COVID-19, influenza, and RSV, you can kind of see how COVID is showing that lull nationally for these weekly emergency department visits. Again, you can kind of see how flu and RSV is slightly upticking. It's, it's a little bit hard to see here, but it is, apparent here. And that also is tied to the colder weather. Again, looking at for the COVID-19 predictions, you can kind of see here how the forecasts currently have it for the remainder of this month and into early November. It's a little bit of a downslide, which is, not a bad thing or a downtrend, but, still, again, these things get updated weekly by CDC, and in turn, these forecasts get changed quite a bit. Same thing for the state of Connecticut with these forecasts for COVID-19, showing a little bit of a downtrend as well. But keep in mind that November is where things do kick up, especially once the Thanksgiving holiday has happened. So just getting ready for that. With that said, looking at RSV and the antigen detections for RSV, you can see again that uptick still occurring, and this is for the state of Connecticut. And then I think actually what's another helpful metric, especially to kind of substitute in lieu of, especially the wastewater monitoring, hopefully that's resolved soon. But more or less, you can see here for influenza-like illness, syndromic surveillance. So again, it's looking at symptoms. So again, there's false positives, but then it gives you a good idea of what the respiratory illness season's playing out as. And you can see actually it's a little bit lower in terms of activity than we've seen in prior presentations. So usually, especially New York City is kind of in that high level, if not moderate. And the Southeast is usually getting impacted quite a bit, but right now, you know, Southeast is still getting impacted. It's in the low, fortunately, but more or less, a lot of the country's still in kind of like it moved back into the lower minimal levels. So that's really kind of good to see. But as you can see, like Alaska and the North Mariana Islands not doing as well relative to this surveillance, but still, you can see how DC is also kind of in that kind of low to almost moderate activity too. You know, cities are obviously going to be the bigger indicator where things are at, but fortunately for Connecticut, you know, we're at that kind of low activity as well. So the Northeast is doing okay at the moment relative to this surveillance. Just keeping in mind this is data up to October 14th. So that's the other kind of delay that we have with all these kind of data sets that kind of, you know, can create a little bit of false sense of security. But right now, at least it is showing that things are experiencing a low overall, you know, and especially in terms of COVID being the bigger driver. But you know, this is the state health department respiratory illness, you know, dashboard. So lots here in terms of the information. They've been trying to mirror kind of what the CDC has provided. So what I tend to like to look at is, again, they're Connecticut focused weekly emergency department visits by respiratory illness for this current season. And as you can see here, again, COVID, you know, is the kind of the big driver here in the green. It is showing that lull as well for the state of Connecticut. And, you know, kind of relative to the Connecticut surveillance, you know, you can kind of see how like influenza and RSV are kind of hanging a little bit low relative to emergency department visits. But again, that doesn't mean that we're not having cases. And as you can see here, like for flu, you know, we're actually having quite a mix here, which is kind of interesting, you know. So we're having, you know, presentation of, you know, type A influenza, which, you know, for those that are subtyped, it's a little bit of a mix of H1N1 and H3N2. But also type B consistently showing up over the weeks. And again, type B seasonal influenza usually you see later in the season, but it's kind of holding a little bit steady. It's not the largest proportion, but it is here. So it's kind of just interesting seeing how that plays out as we kind of move further into the season as well. So that's just kind of something to keep in mind. So overall, that's kind of just like the major items, you know, again, as more details come in and as this dashboard from the state gets fleshed out some more, we'll go into more detail about it. But at the moment, you know, again, to summarize, for COVID, we're currently experiencing a lull in the state of Connecticut, as well as obviously here in Norwalk. You know, RSV and influenza is creeping up slowly in terms of cases. But, you know, just don't fall into a false sense of security as the weather keeps cooling, as we keep having more social events, and especially the big trigger for all this and catalyst is going to be Thanksgiving holiday, you know, the time around there. Just being ready for that, because that time's moving quick, as you know, and by the time we meet next, you know, that's going to be right around almost the holiday starting. So that's going to be something, or actually, yeah, it should be before the holiday. So just be ready for that in terms of just, you know, the quiet before the storm, as I would like to qualify it. So just be mindful of that in terms of just monitoring, especially these CDC county level metrics. Thanks, everybody.
You're welcome.
Thank you, Brian. Thanks as always for a really great informative presentation and updates. Does anybody have any questions for Brian?
No.
All right, so the last item on the agenda is the director's report. So just want to point out that we have our vaccine clinics this week. We have our flu clinics. We'll be at Brian McMahon this evening, and we'll be at the senior center on Thursday morning. So for anyone who's listening who hasn't had the flu shot, you can register and get your flu shot this week. We're also going to be continuing to offer the vaccine for most Thursday afternoons for the month of November. And I also want to let you all know that we have purchased a limited supply of, you know, COVID vaccines as well. So we're waiting for all of that to come in, and we'll be soon offering COVID vaccine as well at the health department. And we'll have private supply as well as, you know, the bridge program, which is for the uninsured and underinsured. We had a press event at the health department on October 13th that I wanted to highlight. I really want to thank Dr. Weinberger, Ken, and Joan for attending that press event, where we had the Commissioner Japani of the Connecticut Department of Public Health come down and visit, as well as Deputy Commissioner Lisa Morrissey, to help promote the importance of the flu vaccine. And we also had several legislators that were there, Senator Duff, and we had Representative Roberts, and And we had the mayor, of course, as our host. And we also had our council president, Greg Burnett, who also was a Board of Health member in the past. And he is also an active member of our emergency response team. And we're also joined by staff as well. So we took some pictures and I just wanted to share them with everyone. So give me a second. I'm gonna put this into. Can you all see the picture?
Oh, that's nice.
I thought it was a really nice picture of all of us that we took. And then we had this one with the commissioner, Senator Duff, and the mayor and Lisa. The mayor giving his remarks. And then the commissioner when she got her vaccine. So we have a lot of actual photos throughout the event. And then here are 3 Board of Health members that represented at the event. So we got to find a way to put this in a publication or on the website or something. But we need a picture of all the board members, but that was great. So the 3 of you guys were there and I was like, I want to take a picture. You're here, let's take this picture. Yeah. So I really want to thank you 3 for being there and representing the board at the event. I had a lot of fun and it got me thinking, and I've been talking to you guys and others that, we need to do more of that. Like we need to do more of those events where we, promote, important health messaging, promote the work of the health department, talk about important, health matters. So I'm hoping to do more of that in the future. So if any of you have any ideas, please let me know. But any thoughts about the event?
I thought it was a well done event, and it was great seeing the mayor and the commissioner there. It was great. Good job, Deanna.
We all pulled it together.
Yeah.
I want to thank the staff too. And I was like, went to them. I'm like, so.
Yeah.
They're like, sure, Deanna, sure. All right. A couple other items for the director's report. We're still plugging along with the supportive work environment policy. So we've completed 5 sessions so far where we've gone through the different elements in the Surgeon General's framework for, workplace mental health and well-being. And so we have another meeting scheduled where we're going to go over all of the findings from the 5 different meetings and figure out like what's the plan ahead, what should be in the policy, what are things that we're not currently doing that we want to do, and kind of help that support the workforce development plan as well as some of our workforce efforts with the funding that we're getting from the state. It was wonderful to have LaToya participate. She's the city's DEI officer, because as we were talking and thinking about needs and ideas, she's like, oh, I can help you with that. I can help you with that. And so it was just wonderful. So we're also going to be figuring out, what are things that she can help support us on. So it's great. And we're going to find ways to continue the work. We're trying to figure out, what is it going to be called moving ahead. But the staff that participated, all different levels of the department, different areas of the department, they said it's been very valuable very valuable meeting, and they want it to continue maybe monthly, where we're kind of checking in with each other. How are things going? Coming up with ideas to make our workplace even better. So they've been really engaged and really honest with me, and I just really, really appreciate that. So we're going to find ways to continue that moving forward. And then I want to share that work with the rest of the state too, so they can, learn from some of the great work that we're doing here to help their health departments as well. And then we ordered another round of COVID test kits using grant funding from the state. And so we're in the middle of doing distribution. And for that, typically in the past when we've done our distribution, we've worked closely with community providers and nonprofits to help us get the test kits out to those who need it the most. So we're going to continue to do that for this round. And those are my main updates. Does anybody have any questions? All right. So if we have no other questions or any other discussions, we can wrap up today.
Deanna, can I say something?
Yeah.
I just wanted to take this opportunity to congratulate a member of our board who will be receiving an award from the Connecticut Nurses Association. Well, well done, Terry. I know she was trying to keep it quiet,
No,
but
I
just
wanna hear
wanted
more.
to take this opportunity.
Thank you, Joan.
That's wonderful. Thank you, Joan, for bringing this up. Tell us about the award. I want to know all about it so we can brag.
Well, I do a lot of work with the Connecticut Nurses Association, and I'm getting an award for service to the organization. I've been involved, as many of us are, in my professional organization pretty much since I started my career. So yeah, I'm getting an award for that. At Mohegan Sun, so it'll be a
Terry.
fancy party. That'll be nice.
Congratulations, Terry. Well deserved. You're
Congratulations.
amazing.
That's great.
Congratulations.
Thank you.
All right. I want to follow up offline too, Terry, get even more information so we can help promote that. Thank you, Joan. Anything else anybody wants to share? All right, then it's 8:49 and we will adjourn. Hope everyone has a great day.
Okay.
You too.
Thanks, everybody.
Bye.